Every single year, millions of Americans confront serious health challenges that profoundly affect their quality of life, overall well-being, and longevity. Today, we'll delve into four critical public health concerns facing our nation: the alarming rise of chronic diseases, the escalating mental health crisis, the persistent opioid epidemic, and the ever-present threat of emerging infectious diseases. Chronic diseases remain a leading cause of illness, disability, and death across the United States, with approximately 60% of American adults, or about 6 in 10, living with at least one chronic condition, and 40% managing two or more. The major types encompass heart disease, cancer, diabetes, obesity, and lung disease, which are frequently linked to preventable risk factors that individuals can address. These conditions are heavily influenced by modifiable factors such as smoking tobacco, poor dietary choices, physical inactivity, and excessive alcohol consumption. Alarmingly, chronic diseases account for a staggering 90% of the nation's annual $4.5 trillion in healthcare costs, imposing an immense financial strain on our healthcare system and economy. Public health initiatives prioritize promoting healthier lifestyles through education, enhancing access to preventive care services, and effectively managing existing chronic conditions to lessen their burden. Simple yet crucial steps like scheduling regular checkups, adopting a balanced, healthy diet, and committing to consistent physical activity can significantly reduce everyone's personal risk. Next, we address the mental health crisis, which is rapidly growing and impacts individuals of all ages, with a particular toll on young people across the country. More than 1 in 5 U.S. adults, over 20%, experience mental illness each year, illustrating just how widespread and pervasive this challenge truly is in our society. Tragically, suicide ranks as the second leading cause of death among people ages 10 to 24, which underscores the critical and urgent need for accessible mental health support. Key contributing factors range from social inequalities and economic disparities to the pervasive influence of technology on daily life and the lingering psychological aftermath of the COVID-19 pandemic. Common symptoms of anxiety, depression, and chronic stress can appear in many forms, such as persistent sadness, overwhelming worry, or physical fatigue, disrupting daily life and overall well-being. If you or someone you care about needs immediate help, vital resources like the 988 Suicide and Crisis Lifeline and various local mental health services are readily available around the clock. The opioid epidemic continues as a devastating public health crisis in the United States, with drug overdose deaths surging to unprecedented levels in recent years. In 2022 alone, opioid overdoses tragically claimed over 80,000 lives, serving as a stark and sobering reminder of the epidemic's devastating severity and scope. Synthetic opioids, particularly fentanyl, have emerged as a dominant factor in these recent fatalities, complicating the crisis and heightening its dangers exponentially. Even prescription opioids, originally intended solely for legitimate pain relief, can unfortunately lead to dependency and addiction, which emphasizes the vital need for careful management and oversight. Effective treatment and comprehensive recovery programs play an essential role, providing structured pathways to healing, sobriety, and a sustainable return to healthy, fulfilling lives. Key prevention strategies include advocating for safe prescribing practices by healthcare providers and launching widespread community awareness campaigns to educate the public. Finally, the persistent threat of emerging infectious diseases remains a top priority and constant concern for public health officials nationwide and globally. Recent prominent examples such as Ebola, Zika virus, COVID-19, and evolving new strains of influenza clearly demonstrate the unpredictable and dynamic nature of these health threats. A major worry involves zoonotic diseases, where approximately 60% of infectious diseases affecting humans originate from animal sources through close interactions. Essential prevention measures encompass widespread vaccination programs, rigorous personal and public hygiene practices, and robust global surveillance systems to detect and control outbreaks early. Additionally, climate change exacerbates the issue by altering ecosystems, expanding habitats for disease vectors like mosquitoes, and thereby influencing the geographic spread of infectious diseases. Importantly, these varied public health issues frequently intersect and disproportionately burden certain populations, shaped by factors like socioeconomic status, race, ethnicity, and geographic location. Tackling these inequities demands targeted interventions, equitable policies, and initiatives that actively promote health equity and address social determinants for every American. By committing to stay informed on these issues, seeking professional help whenever it's needed, and actively supporting public health initiatives, we can collectively forge a healthier future for all Americans. Let's unite in this effort. Adopt sustainable, healthier lifestyles, champion mental health awareness and destigmatization, combat addiction through resources, and advocate strongly for increased public health funding and supportive policies.